plantar fasciitis. What could be done to prevent plantar fasciitis? And if you are suffering from pain in the bottom of the foot or plantar fasciitis, what could be done as far as treatment? There's a lot of things that can contribute to the pain on the bottom of the foot or plantar fasciitis. And if those aren't addressed, you might be suffering from pain for a while, because we are seeing a lot of people getting some type of treatment on the bottom of the foot, not quite responding as well as they should. Then once we start looking at the ankle, the back, or the knee, we see some issues or imbalances in there that may contribute to it. So when we're talking about pain at the bottom of the foot or plantar fasciitis, or actually knee pain in general, or hip pain, really what we need to do, we need to start at the toes and look all the way up to the low back. We need to address all the joints in between. So initially, if you're suffering from pain in the bottom of the foot, we want to look at the arches. One of the best things you should do is just put both feet on the ground, non-weight bearing, so sit in the chair, put both feet on the ground, make a little mark on each side of the arch, take a little ruler and measure that arch. Measure that to 1 inch off the ground, then stand up and see how much that arch drops. If that arch drops a little bit, or you're pronating, that needs to be addressed as far as plantar fasciitis. You may see people running and you see their foot rotating in, or if they're over pronating. So if you're over pronating, that issue has to be addressed, usually with some type of orthotic. As we move up the knee here, what we need to do is we need to look at the Q angle. A Q angle is an angle between your hip and your knee. And typically a smaller Q angle, the better. So what we need to do is we'll take a measurement of this Q angle, and if your Q angle is increased, again, that's typically fixed with some type of orthotic. A semi-rigid type of orthotic. With orthotics, there's a lot of different types of orthotics out there. The orthotics I typically put most people in, I wear myself. I personally have plantar fasciitis and a degenerated knee. And I wear orthotics. I pronate in. So what I do is I like a semi-rigid orthotic, something that's going to have a little bit of give. And typically what we'll also do is maybe put a heel wedge in the orthotic. If you're pronating, a wedge is going to be a little thicker on the inside than the outside, so it's going to adjust the ankle to move that ankle a little bit more in alignment with the knee. If you're pronating and your arch is dropped, you could get that treatment on the bottom of your foot and your calf, but the second you get up and walk around and start running again, that arch is going to collapse and pull on that plantar fascia. So really, the best orthotic that I personally have found and I use is a semi-rigid orthotic with some type of wedge in there, depending on how your arch is dropping. One thing about orthotics that I really do not care for treatment of plantar fasciitis in general is a very stiff, rigid orthotic, and one that has a huge heel cup in the thing. If you have a nice running shoe, you already have a pretty nice heel cup in there, so it's really not that important to have a large heel cup in the shoe. And what we do is we see some people are coming in for plantar fasciitis or knee pain, and they went off and spent $500, $600, $700 in a pair of orthotics, and then we look at their orthotic and we find this real rigid orthotic and with a deep heel cup. If you have a deep heel cup in there, that's going to tend to jack that heel even higher, and it's not going to be very helpful for the pain. If an orthotic is too rigid, it may give that support on the bottom of the foot initially, but then sometimes that foot eventually atrophies away. And you become dependent on the orthotic. So one of the key things in the treatment for plantar fasciitis is some type of semi-rigid orthotic, probably not a heel cup if you're going to put that into a running shoe, and then possibly some type of wedge. And that will address the arch dropping, it could address the pronation, and it could address this Q angle. This Q angle needs to be measured by your sports medicine doctor. Another thing what we want to do as far as the treatment is we want to look at the ankle mobility. A lot of people have a very rigid ankle, and the simple way to test for ankle mobility is stand on the floor and get down to lunge position, and then push your knee as far forward as you can, but keeping that heel on the ground. So if you just kind of get in the lunge position, keep that heel on the ground, lean that knee as far forward as you can, try to get it really ahead of your toes. Now that should be probably 4, 5, 6 inches. Okay, you should be able to go a good distance, the knee in front. If you're an inch or less, half an inch, 2 inches, that means that ankle is very rigid. If you have a rigid joint, like an ankle, typically what's going to happen above or below that is going to start to be a little sloppy. So if you're checking that you have very limited mobility in that ankle joint, that joint needs to get mobilized. Typically you need to go and see a sports chiropractor that could go in there and mobilize that joint or adjust that joint and free it up. If you think of that ankle joint is just all rusted up, okay, if you're not getting 4 inches or more out there, that ankle's rusted up. And if that ankle is kind of rusted up, it could affect the pain on the bottom of the foot or the plantar fascia. So as we go up now, we already tested that Q angle. Another thing that we see in plantar fasciitis a lot that doesn't seem to be addressed is the sacroiliac joint. The sacroiliac joint is the joint right here in the back. It's a little bump that you see or that you feel back in there. A lot of times what could happen is that joint could get rotated back. And if that joint gets rotated back, if that hip gets rotated back, it could pull the hamstring, the gastro, and affect the plantar fascia. This could also affect a knee issue. That's why anytime you're dealing with pain in the foot, the ankle, or knee, we need to look up more than just the area we're having pain. If you're suffering from plantar fasciitis or if you're suffering from any condition in general, there really needs to be 2 diagnoses made. The first one is you have plantar fasciitis. The second one is, why did you get the plantar fasciitis in the first place? So when someone comes in for treatment, you can't just address the pain in the bottom of the foot. If there's issues with the sacroiliac joint that's rotated back and it's causing tightness in the hamstring, the gastrus, and affecting the whole chain, more likely you could treat the plantar fasciitis or pain in the foot. But if that sacroiliac joint is still a problem, typically the pain will come back. If the ankle's still rigid and the ankle mobility isn't being addressed, the pain comes back. If you have this Q angle is a lot bigger, the pain could come back. So there's a lot of issues that contribute to it. So we don't want to have someone who suffers from plantar fasciitis just get treatment on the bottom of the foot. You need to be put through some type of biomechanical screen that's going to address the issues as far as flexibility and stiffness in the joints. The other thing we've got to do now, so we've addressed the sacroiliac joint, we've addressed the Q angle, we've addressed the dropping with the arch, is the adhesions from the plantar fasciitis. And what needs to be done with that is some type of deep tissue therapy on the bottom of the foot and also in the calves. Okay? We can't just work on the bottom of the foot. A lot of people have pain in the bottom of the foot, but they have a lot of stiffness and tightness in the actual calf. And any type of treatment needs to be going on and scrape or really try to break up those adhesions on the bottom of the foot and in the calves. A lot of times people don't address the tightness in the back of the calves, and that leads to recurrent, ongoing plantar fasciitis or pain. The best way to do that initially is see some type of therapist that can really get in there and break that stuff up. I know there's a lot of people out there that will say try the foam rollers. I like the foam rollers, but not when you're suffering right now from the pain. The best thing to do is go, spend the money, see someone that could professionally really address the bottom of the foot, the scraping the bottom of the foot, the calves, the hamstrings, the tensor fasciae lata. Again, we need to free up all the adhesions that you have pretty much from the waist down to the toes. Once the sports chiropractor, the sports massage therapist goes in there and breaks those adhesions up, then that's the place now you can start addressing a foam roller. Okay, because a foam roller is just not going to get specific enough to get in there finely in the various muscles of the lower leg and break up those adhesions. Once that's done, the foam roller or the stick is something like this, is a great thing to do self-massage to the muscles of the legs. But again, the stick is not going to get in there very specific to finally break those up. Get a few treatments, get some deep tissue work done in there, and then once that gets freed up, you could use something like the stick on your quads, your hamstrings, your gastrocs, a foam roller. Those will work quite well to help prevent this. If you go through, before you go through a run, if you get on the foam roller or just that stick, do a few 5, 10 light ones, and all the quads, your hamstrings, the gastrocs, then go run. That generally keeps you looser. When you're done with your run, get in there with the foam roller a little bit better. Couple other type of things as far as the treatment of plantar fasciitis. Again, like I said, we need to find two things. First, what do you have? Plantar fasciitis. We diagnose that. Second thing is, well, why did you get it? And that might be due to some like the stuff I already talked. A sacroiliac joint, a rigid ankle, overpronating. A big thing we see also, though, that contributes to us is weakness of the butt muscles, the gluteus medius, okay? So, you know, I know what everybody starts to do. They start to go, oh, hey, I'm going to start getting the shape. I'm going to go a little bit run. Hey, that felt really good. Now that's going to go run, and they run, and they run. And a lot of people don't do a lot of strength training. So mostly the exercise we want to do some calf presses. That will help out nicely. But really what we need to do is straighten the butt muscles, the gluteus medius. Some type of lunges, single leg squats. You know, a single leg squat, basically I'm talking about, is just standing up, lift one leg up in there, drop down about 5 inches, 6 inches. You don't need to go real deep. Drop down, drop down. The instability on standing one foot from side to side will help engage those muscles of the lower extremity and the glutes and the ab. But the single leg squat, it should be, it's not very harmful for the knee, but it starts to work the glute muscles. So you can just Google gluteus medius exercises, and you'll find a lot of nice ones out there. As far as, you know, some squats, some single leg squats, some lunges, all that type of stuff will really help prevent this from coming back. Another little thing that we found that helps in the treatment and prevention is something that's called like a topical magnesium. And there have been patients who come in who are suffering from plantar fasciitis, cramping on their calves, and we go do deep tissue on the bottom of their foot, deep tissue in the calf. We run electric muscle stim or ultrasound or laser into the calf muscles and the bottom of the foot. And for some reason they seem to just keep having some tightness in their calves. And what we found is a lot of times some people are deficient in some magnesium. And so you throw off this calcium magnesium, this relationship here, and that leads to stiffness and tightness and some muscles. So what you could do is you could just get it's a topical magnesium. You squirt it on the areas of the legs, the muscles. You rub it in real nice. It's a different way of allowing your body to absorb the magnesium. And found that helps with some of the cramping or stiffness that you've had in there. So those are the main issues. And we see a lot of, with plantar fasciitis, it's very stubborn. I mean, one thing that, you know, pay attention to basketball players, okay, are on the news. You hear so-and-so is out for 5 weeks, for 10 weeks, suffering from plantar fasciitis. He's been suffering from plantar fasciitis all year. And remember, now he's a professional athlete. His job is to get therapy. Okay, so if he's suffering from plantar fasciitis, every day this guy's getting therapy. So sometimes it is beneficial to get a little extra help. Go see a sports chiropractor, a sports medicine doctor, a sports massage therapist. But remember, there's a lot more issues than lots of times just the pain on the bottom of the foot. You need to